question is, how can we hold elective officials accountable for Black maternal health policies?
And that's a great question. And so, of course, off the heels of the election cycle with last week, I think the most important thing for us is to look at who we've elected from a local standpoint. Not only, and I want to say local, I mean from a county perspective as well as from a state perspective as well, and hold them accountable. There is no way in which we should only be seeing, our district representatives and our state representatives only when it's time for election, because these are the people in which we have elected to hear our issues, to come together to address them, and then to take them back to those administrative bodies or those legislative bodies that can actually pass policies and put them into place, from that perspective as it pertains to elected officials. So I would say the first thing is to get together. We know that this is a collective issue, not only, on the neighborhood levels. We have to bring community back, specifically within our communities that we're working in, and begin to, organize, put things into number, but then put things into a format in which these elected officials understand. So as my colleague always says, we have to speak their language, because we can show up, we can talk, but if it's not formatted in a way, in which they're used to talking and that doesn't have data behind it in which to drive, and it's just, not in a clear, concise agenda, oftentimes that can fall into deaf ears. So definitely getting together, clear expectations and goals in which we are aiming to achieve. But then also to showing up, getting on their listservs, emailing them, calling them, having them show up, inviting them, to the events that are taking place in the community, especially our local elected representatives. They're right here in the city. So when we're having, these community events, we're having town halls, you're having neighborhood organization meetings, invite them there. Please lean on them, and pull them into that so that they can hear the day-to-day issues that are taking place. But in the space of us organizing, like I said, we have to know what's going on. I know I've worked in a couple different neighborhoods, particularly one where they've had 4 young women that died from adverse related events, as within the postpartum period. So that's 4 women that died. So clearly just within that neighborhood, that is an issue in which they should be raising to fall into the ears of their district person.
Mhm.
And to look, at existing data and to put together, talking points in which to propel forward to advocate, for more resources. What healthcare systems are they visiting? To make sure that there's adequate training, there's adequate funding and policies, and working with their officials to make sure that that stuff is passed. So checking in with them, using the data that's available, and then also too, just bringing to light these issues. We can't keep them, covered. We can't keep them, under wraps within the neighborhoods that are happening. We have to continue to shout it from the mountaintops, that this is taking place, particularly in our areas. This is what we're organizing to do. And this is how we're going to move forward. And this is what we want to see with our outcomes. And how are you going to help make it happen? And if you're not doing anything to make it happen, then it's time for us to move on to an elected official that will. Because as we see, votes were all over the place, with this election cycle and what was represented. So clearly they do matter. And we have to make that known that we won't be afraid, to put somebody else in there that's going to handle these issues. And that boils down to education as well, with the community, knowing the resources that are there, getting trained on that. And then, like I said, coming together to put that collective voice to move forward and to stick down on those issues.
I love that the part that you brought up in regards to really focusing on the local level. I know from experience and conversations that I have with, colleagues or just family members and friends, a lot of people highlight or the 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 US highlight more of like federal level,
Hmm.
right? They don't really
Hmm.
highlight the impact of state, local. They don't. So a lot of times we're just focusing, okay, what is, President-elect Trump going to do now? But now
Hmm.
I feel defeated. I feel like, okay, he has the voice and has the control to make decisions for us in regards to a nation,
Hmm.
but it's understanding like the point you made that also we can make change on a local level.
Absolutely, absolutely. So while we may be, not pleased with the results of things that happen on the federal level, we have to look at, the positive of what happened on our state level, and who we have. That's the governor and, the lieutenant governor of our state. And what that will do, with the fight, with the dissemination of funds down to our local level, down to the county level, and, within the space of grants, things of that sort, in which we can use to continue doing holistic methods or holistic programs in which to address, all the determinants that go into maternal health. I would say that in North Carolina, we are at an advantage, and then particularly within Mecklenburg County, we're at an advantage. But we have to know who's at the table
Mhm.
for our, local neighborhood levels, moving out to county, and then moving out to state, so that we can, really push the issues forward.